Hello everyone, let's have a review regarding tumor immunology. The different topics in this video would be first, some definition of terms related to tumor, and then we'll talk about some antigens that may be produced by tumors or normal cells, and then after the antigens we have to talk about the immunity that our body can give against these tumors, and lastly, as laboratory scientists, we'll talk about some tumor markers used for laboratory testing. Let's start with the basic definition of terms. The first term to be defined is neoplasm, which comes from two Greek words neo and plasma. Neo, which means new, and plasma, which means formation. So by definition, a neoplasm is referred to as an uncontrolled growth or formation of new cells. But these new cells that are formed are not the same as the other normal cells surrounding them. Since they are uncontrolled and abnormal, a neoplasm is also referred to as an abnormal mass of tissue. Abnormal because 1. These cells can divide more rapidly compared to the other normal cells, and 2. These cells do not die when they should. In normal conditions, our cells can grow, divide, and die in an orderly fashion, which is regulated and controlled by the DNA machinery inside the cells. So during childhood, cells rapidly divide. But when we reach adulthood, these cells would only divide when they have to replace any worn out or dying cells, or in circumstances, repair any injured cells. So neoplasia describes the condition when these normal cells would proliferate in an abnormal manner. And these rogue cells are what we now call as neoplastic cells. Again, these neoplastic cells cannot be controlled in a normal way because 1. They divide more rapidly and they do not die when they should. Now, when these abnormal mass would excessively grow, a tumor or a lump may be eventually formed. That's why a neoplasm is also called a tumor. And tumors may either be benign or non-cancerous, or malignant or cancerous. Our second definition of term is benign tumor or benign neoplasm, which is described as a mild and non-progressive tumor. Mild because it grows slower when compared to malignant tumors or malignant neoplasms, and non-progressive because they do not invade. They do not have the capacity to spread to the other areas of the body because they have a protective sac with distinctive borders that keeps the neoplastic cells in place. They simply push away the normal tissues as they compete for space. Benign tumors are usually non-life-threatening, but if they cause any signs and symptoms as they push the vital neighboring structures, then treatment can be done, and usually the treatment requires the removal of these tumors through surgery. The cause of a benign neoplasm is often not known, but several factors such as exposure to radiation and environmental toxins, genetics, diet, stress, inflammation, infection, and the local trauma or injury may be linked to the formation of these growths. There are different forms of benign tumor and they can arise in different body structures. Some of the main forms of benign tumors include adenomas, fibromas, hemangiomas, and lipomas. First are adenomas. Adenomas develop in the epithelial tissue that covers organs, glands, or other structures. A polyp that has formed in the colon is an example of an adenoma, and this can be removed surgically. The second type of benign tumor are fibromas. These are growths that arise in the connective or the fibrous tissue, and they can grow in any organ. Fibromas can also cause symptoms, and these may need to be removed surgically. The third type of benign tumor are hemangiomas. Hemangiomas are blood vessels that have accumulated in the skin or internal organs, and they form a red or blue growth. Birthmarks are an example of hemangioma that can disappear by themselves. And the fourth type of benign tumor is lipoma. Lipomas arise from fat cells, and these are the most common type of benign tumor in adults. Lipomas may be treated with steroid therapy, or they can also be removed surgically, or there is also liposuction. Next, we have malignant tumor, and malignant is used to describe a tumor or a neoplasm that has become cancerous. And there are three distinct features for a malignant tumor. First is that they have poorly differentiated cells with very abnormal cell growths. Second is that they have the capacity to invade the surrounding tissues or the surrounding normal cells. And third, they have the capacity to spread to distant organs or to other parts of the body via the blood vessel or the lymphatic channel. We call this capability as metastasis. The extent of metastasis upon diagnosis is referred to as the cancer stage, and most cancers are categorized using a staging system that ranges from 0 to 4. Some of the main types of cancers are described below. Carcinomas often begin in the skin or the tissues that line internal organs. Leukemias affect the bone marrow, which is in charge for the different blood cell production, but it mainly affects the leukocytes or the white blood cells. Lymphomas originate in the immune system and begins with the lymphocytes. The lymphocytes are the infection-fighting cells of the immune system. Sarcomas develop in connective tissues like muscles, blood vessels, cartilage, and bone. And lastly, cancer of the central nervous system is a form of cancer that originates in the tissues of the spinal cord or the brain. And lastly, we have the metastatic tumor, also referred to as the secondary tumor. Secondary because this is from the primary malignant tumor. The primary malignant tumor is seen in the part of the body where the tumor or the cancer has started. So in this picture, this is your secondary tumor or metastatic tumor, and the ones at the background would be your primary tumor. So in another sense, a secondary tumor can be described as a breakaway cell from the primary tumor that has traveled to the other parts of the body. And traveling or metastasis may be done in different ways. The tumor may grow directly into the different organs surrounding the neoplastic cells, or they can travel through the blood vessels or the lymphatic system. The second topic for this video would be the different tumor antigens, and these are the tumor-specific antigens, tumor-associated antigens, the carcinofetal antigens, and the fourth would be the spontaneous tumor antigens. The first antigen is the tumor-specific antigen, abbreviated as TSA. These are intracellular proteins or molecules that are specific for tumor cells. So we can say that TSAs are uniquely found in tumors because they are not found or formed in normal cells. Another name for the tumor-specific antigens would be the tumor neoantigen. Neo because these are new peptides that are formed in the surface of a tumor cell, and these can be recognized by the T cell receptors via the MHC class I and class II interaction. These tumor neoantigens can also be chemically induced, which is usually done for research purposes. An example of a TSA is the AFP or the alpha fetoprotein, which is expressed in the germ cell tumor or in hepatocarcinoma. The second type of antigen is the tumor-associated antigen or the TAAs. These are also intracellular proteins or molecules, but the difference with the TSA is that TAAs are found in both tumor and normal tissue. although they can be expressed in much higher amounts in tumor compared to normal tissue. Because of this, TAAs are considered to be not specific, and aside from being seen on both tumor and normal cells, TAAs can also be shared with different various tumors. So that means different tumors may have the same TAAs. An example of this would be the P97, which is a transferrin growth factor that helps or aids in the transfer or transport of iron into the cell. In normal conditions, there is around less than 8,000 molecules of P97 in a single cell, but in melanoma, the value increases to 50,000 to 500,000 molecules per cell. The third antigens would be the carcinofetal antigens, which are produced normally during the fetal development and would start to decline at birth. So that means only minute amounts of these antigens should be present after birth. These types of antigens would have an increased amount in adults in cases where there are malignant transformations, and the gene products of these malignant transformations are known as oncofetal proteins. An example of these oncofetal proteins would be the CEA, or the carcinoembryonic antigen, and the AFP. One characteristic of these oncofetal proteins is that they are recognized as self since they were produced during fetal development. So that means they cannot elicit any humoral or cell-mediated responses. The fourth type of antigen are the spontaneous tumor antigens, and these are antigens that are produced from tumors with no known mechanism. Studies have shown that these kinds of tumors do not produce any unique antigens, and the importance of these tumors and antigens up to this day still remain unclear. For our third topic in this video would be about the different immunities that we have against these tumors. We'll divide them according to the natural immunity, humoral mediated immunity, and the T-cell mediated immunity. The first category would be natural immunity, and under this is a macrophage. Activated macrophages have been successfully used in cancer immunotherapy. Macrophages have different mechanisms in dealing with tumor cells, and one method is a direct method where cytotoxic effects happen. A macrophage will release toxic substances and chemicals that would be detrimental for tumor cells. Examples of these substances would be the TNF and nitric oxides. Also under this method would be the phagocytosis. TNF stands for tumor necrosis factor, and as the name implies, this can kill tumor cells through a direct toxic effect or by indirectly affecting the tumor vasculature. A tumor vasculature pertains to the blood vessels that have formed around the tumor cells and supports its growth. Another mechanism against tumor cells would be a direct cytolysis through the aid of the antibody-dependent cellular cytotoxicity. So that means the cancer cell should be wrapped with antibodies for the macrophage to do its work. And lastly, we have the indirect method where a macrophage would recruit other immune cells that can be cytotoxic or that can kill the tumor cells. Still under natural immunity, we have the natural killer cells, or the NK cells. These are also lymphocytes like the T and B cells, but they are granulated. The NK cells were first noticed for their ability to kill the tumors without priming or without prior activation. NK cells function for immunosurveillance as they constantly patrol and check the other cells. They can recognize all the cells that belong to the body. This is possible because normal cells have an MHC1 in their surface that the natural killer cells can identify. NK cells function to kill tumors because tumors will lose these MH1 cells on their surface that would allow the natural killer cells to identify them as non-self. The second category for the tumor immunity would be the T cell mediated immunity. And under here we have the cytokines and the involvement of the cytolytic T lymphocytes. Cytokines are small proteins that are important in cell signaling. Examples of these cytokines important in tumor immunology would be the interleukin, T necrosis factor, and the interferon gamma. Cytolytic T lymphocytes or cytotoxic T lymphocytes, abbreviated as CTLs, provide an effective anti-tumor immunity by directly lysing the tumor cells. Examples of cytokines would be the interleukin 1, which activates the T cells, the B cells, and the NK cells. Another function is that they can induce fever, and these are critical functions that are involved in malignancies. The second cytokine would be the T necrosis factor or the tumor necrosis factor alpha. And aside from the ones mentioned earlier, this is an acute inflammatory cytokine which destroys tumor cells either by necrosis or apoptosis. The third type of cytokine is the interferon gamma, which are produced by the T cells and the NK cells, and these are responsible for the stimulation of the anti-tumor immune response. The third and last category for our tumor immunity would be the humoral mediated immunity, and this has something to do with the antibodies and the complement activation. Antibodies are probably less important than T cells when it comes to tumor immunology, but since tumor antigens cause the production of specific tumor antibodies, these then serve as good tumor markers that are used in laboratory testing. Tumor cells can be lysed through the complement activation or through the antibody-dependent cellular cytotoxicity, and this involves the NK cells, PMNs, and the macrophages. And the last topic for this video would be the tumor markers. Tumor markers are glycoproteins that are normally present in very minimum amounts, but become elevated when there is cancer. That is why we can use them for screening, diagnosis, monitoring, and to prognosticate cancer. Tumor markers are substances that may either be present in the tumor or that may be produced by the tumors themselves. That's why we can use them for the detection of cancer by measuring them in the blood, the body fluid, the cells, or the tissues. Tumor markers may be categorized into 6, and the first one are the cell surface markers that include the estrogen receptor and the progesterone receptor, also called as the ER/PR. The second one would be the proteins, and this includes the thyroglobulin and the Bence-Jones proteins. The third category is the Oncofetal Antigens, which has the AFP and the CEA. The fourth category is the carbohydrate antigen that has the CA125, CA153, CA7224, and CA199. The fifth category is the enzymes with the prostate-specific antigen or the PSA and the neuron-specific enolase. And lastly, we have the hormones that includes the HCG and the calcitonin. We will only be discussing a few of these tumor markers in this video, and these would be the oncofetal antigens, PSA, and the HCG. Let's start with the oncofetal antigens, and these are the CEA and the AFP. One similarity of these antigens is that both of them are normally found during fetal development. CEA stands for carcinoembryonic antigen, which is normally high during the second trimester of pregnancy. In abnormal conditions, an increased CEA level at its highest form would be seen in metastatic diseases. CEA levels are also used in the management of gastrointestinal tumors or in adenocarcinomas that may be found either in the colon, pancreas, liver, and lungs. Increased CEA levels may also be found in other conditions like an inflammatory bowel disease, ulcerative colitis, Crohn's disease, polyps, GIT tumors, and in cigarette smokers. AFP is also normally seen in embryonic and fetal development. It is most important in the use of monitoring cancer therapy, which should be obtained every 2 to 4 weeks. High levels of AFP may also be seen in hepatocellular carcinoma, hepatoblastoma, and in testicular and ovarian cancer. High levels may also be found in other conditions like viral hepatitis, cirrhosis, and ulcerative colitis. To differentiate CEA and AFP, CEA is usually found in the gastrointestinal tract, while AFP increased levels are usually seen in liver conditions or liver cancer. We are now down to the last two tumor markers, the hormone HCG and the enzyme PSA. HCG stands for human chorionic gonadotropin, and this is normally seen in pregnancy. This can be detected in the serum or in the urine of pregnant individuals. It has two subunits, the alpha and the beta HCG. The beta HCG is the one found in testicular cancer and in other tumors. HCG levels may also be useful in the evaluation of gestational trophoblastic disease, testicular tumors, and in ovarian germ cell tumors. PSA, on the other hand, is normal in men because they are produced in low amounts by the prostate tissue. That's why the PSA is used in the screening for prostate cancer. PSA, aside from an increase in prostate cancer, may also be seen in benign prostatic hypertrophy and in acute or chronic prostatitis. The levels of PSA may be used to correlate the prostate size, the stage of the cancer, and the treatment response of the patient. And that ends this video. That is a review about the tumor immunology. Thank you very much for watching.